come back, roaring back in new and unpredictable forms. So we're unfortunately in one of those challenging moments right now. From the perspective of raw case numbers, it's really quite startling. It's the most challenging time when we look at case numbers of the last 2 years. We're adding more cases daily now than we were adding weekly a month ago, and the trend continues to move upward. So think about that. So as we look at different ways to fight the virus, we've got to be adaptive, we got to be nimble in addition to being humble, and we got to be determined too, because we know if we don't take adaptive measures, it's just going to be worse. We saw that just 1 year ago when our city, led by our public health and wellness team, which has been doing a great job here over these past couple of years fighting the virus, we had untold numbers, thousands of supporters show up when we launched the Luvax drive-through vaccine site at Broadbent Arena. This was a great example of entrepreneurism, of community service, of dedication and determination to safeguard the public health, the health of each and one of our citizens. And then through the spring, our team and volunteers administered almost 120,000 shots of these life-saving vaccines. And when we started this effort around Luvax, and Dr. Hartledge was our leader, you'll be hearing from her in a second, we started with one. And then, boy, it just kept growing and growing and growing. It was an enormous challenge, but we rose to it just like we will with this here today. Luvax came together very quickly and no doubt saved countless lives, and it helped get schools opened in-person learning as well. And I believe Luvax will go down as one of our city's greatest achievements. It will always be referred to in the history book. So for everybody that was involved with that, again, thank you. Today, the critical vaccines are widely available in our city at over 100 different locations in our community, including Luvax mobile clinics. So we feel like we've got the vaccine effort under control, first shot, second shot, boosters, lots of availability, lots of locations. So we want to focus more on testing to make sure that part of the solution has the resources it needs. So we first learned about Omicron when we were watching it around the world around Thanksgiving. And in just a matter of weeks, it's caused an unimaginable surge of COVID-19 cases across the world, across the country, and across the cities I just mentioned. And so it's creating immense pressure on our healthcare system, which in turn creates a greater need for testing. So, what we're trying to avoid here is our hospital system being overrun with patients and then pushes the most serious health challenges out into the community, and just the wait times for people to be serviced in the hospital would become unacceptable. So today, I'm thankful that we're announcing a partnership among our city, Blue Water Diagnostic Laboratory, and Churchill Downs to offer drive-through testing at the historic racetrack starting Monday. It will operate from 8 a.m. to 4:30 p.m. Monday through Saturday. We've all seen the pictures of the huge lines, people waiting for testing. So we're hopeful that this uh, resource here is going to be a great relief to people that need to get more testing. Now, pre-registration will be required. It's easy to do that online. You can see on the screen here the website, my.primary.health/L/Churchill Downs. You can also find a link at louisvilleky.gov/COVID-19. Dina English of Blue Water will join us in a moment to provide the details on the Churchill Downs site. So I'm pleased to say that Blue Water will also facilitate a public safety line at Churchill Downs so that we can move more quickly more critical public safety workers and workers in public safety agencies throughout Jefferson County, making it easier to keep them safe and on the job. We'll have more details on that shortly, but we want to make sure we keep as many of our public safety professionals on the job as possible. And testing is one of the important steps we can take to keep ourselves safe. When you think about the Churchill Downs location, it's centrally located in the city. And then we're also working to establish a new testing location in West Louisville, and we'll share details on that in the coming days. Please keep this in mind. If you test and you're negative, you have the peace of mind knowing that you're not infecting other folks. And this is on everybody's mind right now. If you test positive, you can move quickly to take the proper medical steps to protect yourself while also helping us as a community contain the virus. So if you're thinking about getting together with your grandchildren this weekend and you want to make sure that you're in good shape, get tested so you can do that with confidence and not have to worry about passing the virus along to a grandchild or to a child or to a grandmother. So once, if you are positive, please follow the quarantine and isolation guidelines if you have COVID-19. No matter what, by registering and using this new drive-through testing site, you'll be taking a critical step to reverse this epic surge in new cases. Everybody can do something to participate in the solution. So get tested, wear quality mask in public, and avoid unnecessary contact with others. And of course, getting the vaccine and getting boosted is the best step you can take. If you're unvaccinated, please talk with your doctor or your pharmacist today about any questions that you might have and get your shot. We're still seeing people for getting their first shot, so that is taking place. We'd like to see it happen faster, but it is still happening. We all know the vaccines offer the best protection against serious illness from the virus, especially if you're boosted. And if you're vaccinated and eligible for a booster, then go ahead and get boosted as soon as you can. So let's now get into the testing here. Blue Water has been a great partner of ours throughout this pandemic. They've had a tough job. You know, when you think about the volatility of the virus and it's really high sometimes and then it goes away for a couple months, staffing facilities and putting up a facility with that type of volatility is a big challenge. So I want to thank Blue Water for once again rising to that challenge. So Dina, please share some details with us.
Yes, thank you, Mayor. And, 2 years ago, nobody knew how to do COVID testing. So I think my hat is off to all of us on the front lines that have sort of been able to maneuver that curve. Blue Water is excited to partner with the city to offer this mass testing site at Churchill Downs at the Orange parking lot beginning Monday, January the 10th. It will go Monday through Saturday from 8 to 4:30. We have 6 dedicated lanes. We have one that is dedicated to the employees and staff of Metro Louisville. We have one that is dedicated to rapid testing, and all 4 other lanes are dedicated to public testing. Someone that would like to be tested would need to bring their government issued identification, their driver's license or passport, what have you, and also their insurance card. Now, if they do not have insurance, we will ask for their social security number. And then that way we can cross-reference to make sure that there is no social security. And then we can submit that to the federal government for the CARES Act. We have 2 different registration links. One is you showed the link just a second ago. We have one link that is for the public testing, and then the other one is for Metro Louisville employee testing. We have a 48 to 72 hour turnaround time. Most of our tests will be returned prior to that, but we say 48 to 72 hours because we've seen such a large spike in testing that we wanted to say 48 hours. We were saying 24 hours, but now we're saying 48 to 72. We have a designated client services team that can help whenever someone is having trouble accessing their results. And additionally, if someone cannot use the QR code, then there is a website that they just click here, and that takes them directly to the registration.
All right, so thank you. So obviously what you're saying that this is free of charge, right? You want to bring your insurance or your social security number, but we do not want cost to be a barrier for people to get tested. So we're looking forward to getting started here on Monday, right? So also want to thank Churchill Downs. They were pleased to step up and be part of this community solution. So obviously a great iconic member of corporate family and the whole family here in Louisville. So thank you to Churchill Downs. I'd like to bring in Dr. Sarah Beth Hartledge. Dr. Hartledge is our Associate Medical Director of our Public Health and Wellness Department, of course, well known since the pandemic has visited our city. So, Dr. Hartledge, why don't you bring us up to speed? Things are changing so rapidly with the virus that you want to talk to us about our positivity rate. How does it rank throughout the pandemic, and just general thoughts you have right now?
Yeah, so Omicron continues to break new records every day. We have a current positivity rate this morning of 28.8, so really closing in on 30%, which is unprecedented heights for positivity rate. Our incidence rate is another all-time high today at 258 per 100,000, and prior to the last week or so, we had never seen a three-digit incident rate. So the previous records were in the 80s back in 2020 or in the fall of 2021 with Delta. So much, much higher than the case counts with Delta. We logged over 4,100 new cases yesterday. So if that rate holds, we could certainly see as many as 20,000 new cases in a week's time.
And a year ago, we were kind of freaked out when there was 4,000 in a week. So we're just seeing this huge scaling right now. So talk to us then now about what are we seeing in the hospitals as a result of this?
So the good news is that for many people, the Omicron infection is milder. The symptoms are less severe. That certainly does not hold true for everyone, and there are always going to be those who get sick and who require hospitalization, ICU care, ventilator use. Even if that percentage for Omicron is much smaller, the sheer number of cases still means that that can place significant strain on the hospital systems. At this moment, the inpatient census, that is those who have been admitted, is not so much the problem. It's the doctor's offices are very full. The urgent cares have hours long waits. Emergency rooms also sort of bursting at the seams. And at the same time, our healthcare partners continue to struggle with staffing and availability of nurses and other healthcare providers to take care of those patients.
Hmm. And can you remind us of the basics? Like why is testing important? It's like, okay, I got the virus. Why is that important? I mean, how's that going to help?
So knowing that you are positive or negative is important for guiding your activities and mitigating your risk as needed. So you gave a great example of if you're planning to go and see your family, you may have, a grandma in her 80s who may be more susceptible, and you may also have children who are too young to be vaccinated yet who are susceptible. So knowing that you are positive in that setting could encourage you to maybe sit this one out and join the family by Zoom. And at the same time, if you have tested negative, especially if you are testing regularly and continue to test negative, that can help reassure you about the safety of your going to work or school or those other events or issues that you need to take care of with the proper protections in place. So we still would encourage you to wear a face covering and avoid those crowds as much as you can.
Okay. And I'm getting questions where people are confused on whether they should be doing rapid tests, if they can get a rapid test or a PCR test. So can you just remind us the difference between them and when you should use one versus the other?
Sure. So the the PCR test is the gold standard. So that is the most accurate test. The disadvantage to PCR is that it's not an instant result. So if you are not symptomatic and you're just trying to check before you go see your grandkids for the weekend, um, PCR tests sometimes have a longer wait to access the test because it has to be done by a healthcare provider. So you need to go to a site like this one or your doctor's office, et cetera. And then you'll have to wait at least 24 hours, but maybe up to 72 for results to come back to give you the answer that you were looking for. The antigen tests are rapid tests. Those are the same as the home test kits. So the home test kits can be difficult to find depending on when your retailer gets their shipments and there are some shortages nationwide. So it can be a challenge to get your hands on a home test. The rapid test that you're going to get from a drive-through site is essentially the same. So you get an answer right away. There has been some concern about Omicron and the reliability of those rapid tests. And so far, it looks like if you get a positive from an antigen test, that it is very likely to be a true positive. So you can absolutely believe a positive from an antigen test. If you get a negative and you still have symptoms, it may just be that you don't have enough of the virus there in your nose to be detected yet. So if you have symptoms, we would encourage you to continue to isolate at home and to repeat your test in a couple days if it's negative. So a positive antigen test, a positive rapid test is definitely a positive. If you get a negative test and you have symptoms, you probably want to think about repeating it so that you can be sure. The PCR test is the gold standard, but there may be a wait associated with getting the test and then a wait associated with getting the result back as well.
Got it. Okay, thank you very much. Okay, with that, let's head over to the questions from the media. I'll turn it back over to you, Jess or Kathy.
Okay, thanks, Mayor. The first few questions in the chat are about the new site, so we'll throw those to Dina. Dina, Sarah Ladd with the Courier-Journal asks, how many tests a day does the site want to do and how many can it do?
We are expecting and hoping, and our capacity level is between 1,000 to 3,000 a day.
Okay, Sarah asks, will the health department personnel be running the site or volunteers?
Blue Water employees will be running the site.
Okay, thanks, Dina. And Sarah's last question is, does the site have an end date at this point, or will it run until it's no longer needed?
It's indefinite at this point, until we're no longer needed.
Okay, thanks, Dina.
And we love Blue Water, but we want it over as soon as possible. I think everybody does. So, okay, folks. Well, thanks for joining us today. It's been a marathon for the media. I know covering this over the last 2 years as well. And we appreciate your all's flexibility to this. So if you could help get this information out, obviously it's another major facility here for the community to get tested and help control the virus and keep us all safe as possible. So thanks for joining us here this morning, and stay safe and stay warm. Take care.
Thank you, Mayor.